While some cancers have no known cause, there are risk factors that we are aware of for many of them. A risk factor is a condition or action that can increase the likelihood of developing certain types of cancers. Risk factors include environmental conditions, habits or specific lifestyle choices, and heredity. Lifestyle choices account for a high number of cancers and are easily preventable. In fact, nearly 2/3 of all cancer deaths in the U.S. have risk factors that can be minimized or eliminated. Some preventable risk factors include tobacco use, poor diet, not getting vaccinated, sun exposure, and lack of exercise. There's plenty of research which shows that smoking and chewing tobacco is the leading cause of lung cancer and cancers of the mouth. Obesity is also a risk factor for certain types of cancer. While there are many hereditary or health-related causes to obesity, often better choices in diet and increased exercise can minimize the risk of developing these cancers. Some high-risk HPV infections can lead to cell changes that, if left untreated, may progress to cancer. Cancer risks are also found in our environment. In many cases, environmental risks are not widely known until a high percentage of the population has become ill. Though we do know that certain types of foods and preservatives contribute to higher cancer rates, there are also hereditary risk factors. It's thought that there may be some difference in the genetic code which makes family members more susceptible to these types of cancers. Knowing that there were cases of a specific cancer in more than one blood family member puts you at a higher risk to develop the disease. Some cancers that tend to run in families include breast, prostate, melanoma, and colon. Education and health-related actions are your two best weapons to protect yourself from cancer. Once you're educated about the causes, you can limit the risk factors in your life. There are many actions you can take to improve your overall lifestyle and limit your risk of becoming ill. A healthy diet and regular exercise decreases your chances of developing certain types of cancers. This type of healthy choice will also decrease your chances of developing illnesses like diabetes. Smoking causes about 1/3 of all cancer deaths. While you can't go back in time and erase all of the cigarettes you've smoked, it's never too late to stop. Quitting today reduces your risk drastically, and your odds of getting cancer go down every year that you're smoke-free. More than half of the U.S. population is overweight, and obesity is a known risk factor for cancer. If you're overweight, it's important to work on eating a more healthy diet and adding physical activity to your day. Your diet should include the proper portions and nutrients. It's not only about limiting calories, but eating foods that are good for your body and provide the right energy to keep you healthy. A healthy body is less likely to develop certain types of illnesses. Limit your intake of processed foods or junk foods. Make sure that you eat enough servings of fruits and vegetables. 5 to 9 servings a day is recommended. Processed meats and red meats should be eaten in moderation. Better choices include chicken and fish. Drinking heavily is also a known risk factor for certain types of cancer. Though there are studies that indicate 1 glass of wine or mug of beer a day can be beneficial. Risk factors start if you drink heavily on a regular basis, more than 2 drinks a day, or binge drink often. Guarding against sun exposure is another easy lifestyle choice you can make to eliminate some of your risk. Regular sun exposure causes skin damage, which can lead to melanoma and various types of cancers. If you have been diagnosed with HPV, it's important that you talk to your doctor about the risk they pose for cancer. If you do not have HPV, getting immunized at an early age will protect you from contracting the conditions. Other behaviors that can contribute to future cancer risks include unprotected sex and sharing needles. These actions put you at a higher risk for HPV, HIV, and hepatitis B and C. The best prevention is to get regular screenings. Your doctor can screen you for cancers that you're at a higher risk for and those that are common, including colon, breast, mouth, Skin and prostate. With regular screenings, you'll be able to detect any cancer early, which makes your odds of successful treatment much better.